We're a team of district nurses, large team, 18 of us, different skill mixes consisting of district nursing sisters, staff nurses and healthcare assistants. And we cover the practice populations of the GP practices that we're attached to. We cover the whole populations, but we tend to work with the elderly mostly. So we offer sort of numerous opportunities really. Our work consists of things like palliative care. We nurse quite a lot of patients at home when they die. There's also a big emphasis now, because we work with a community matron within the team, so there's a big emphasis on long-term conditions and the management of long-term conditions, preventing hospital admissions and things. We work with a large team of multidisciplinary health workers and specialist nurses, things like Macmillan, diabetic specialist nurses. So they would come out with one of the staff day to day to see our general day-to-day work, but we can also offer them other opportunities in the GP practices, going out with specialist nurses, wound care clinics. If they've got a specialist interest, then we can quite often accommodate that. We can get in touch with someone, say if they want to go out with a diabetic nurse, or they wanted to go out with a social worker or intermediate care, then they can do that. When we know who we're getting, we allocate mentors. Sometimes if it's part-time staff, there might be 2 mentors. And normally on the first day, there's some sort of induction. They're welcomed into the team. They're shown around the clinic. They're told who their mentors will be. And we usually try and do them a programme. Having students in the team is a two-way thing. They bring freshness, innovations from the hospital, their knowledge from a hospital setting into the team, which stimulates discussion within the team and can lead to further research and further development within the team. From the students' point of view, they get the benefit of the experience within the team, of seeing patients in the community, which is very different to them, having access to the multidisciplinary team and a host of specialist services, and seeing how district nursing works on a 24-hour basis. Sometimes they can be quite quiet in people's houses, but that's fine, because then if it was a difficult visit, you would have a discussion about that beforehand, and then when they would sit and watch what went on. But I would encourage them to be part of the conversation if they felt able to or to contribute, and then maybe reflect on it after when you come out, really, to see what their impression of it is, really. We have had students that have been particularly upset if we're going into patients that are dying, maybe if they've had a bereavement recently, so I think that can be maybe difficult for them. Or sometimes that might be their first experience of dying patients. And I think sometimes in the community they see the family dynamics probably maybe more sometimes than in hospital, so they can see the effect it's having on the relatives. But they can always come back and talk one-to-one or talk to the team about it. As mentors, we all have a qualification, a mentoring qualification, and also we have yearly mentor updates. And we're in close touch with the practice facilitators and the university. So that if we had a significant problem that we felt needed extra support about, we would be going to the practice facilitators and the linked tutors at the university to ask them to come in, and that has happened. Mentoring students is part of all of our roles, and I think that goes without saying almost, really. And in a way, it's very important. Every placement is really important for the students, but I think sometimes they come into the community not really knowing what to expect, and I think it's just about giving them the confidence and support, explaining to them that they won't have any trouble at all meeting their objectives, that there's numerous ways that they'll be going to be doing it. There's a very supportive team around them.